Well, it's day 2 of the 21st International AIDS Conference in Durban, where thousands of health experts, politicians, activists and researchers have converged to discuss the global response to HIV. Critical issues are under the spotlight, and officials are hoping this year's conference will inspire new ideas in the fight against AIDS. Our reporters have been covering the conference for us, bringing us all the interviews and analysis. And for more now, we cross to our reporter, Blain Herman, live from Durban. Blain, a very good afternoon to you.
Yeah, very good afternoon, Natasha. Good afternoon, everybody. Indeed, globally, new infection rates among adults as well as children were reduced by about 40% since its peak in 1997. Since then, new analysis has shown, especially from UNAIDS, saying that new infections from adults has actually stalled, failing to decline in at least 5 years. Why is this so? Well, let's get more insight about this and other issues. Michel Sidibé joins me now live. He is the Executive Director of UNAIDS. So thank you very much indeed.
Thank you very much.
It's a great honor
my pleasure to have you also today.
Critical conference here in Durban. We know the stats now. Stalling of new infections among adults. What's the possible reasons?
You know, let me just say first that this conference, we have the spirit of Nkosi Johnson with us. I think this boy called for social justice, called for breaking this difference between people who have and people who don't have, and change completely the paradigm. We have been able to see change in South Africa, from denial to really action.
It was a real game changer.
Oh, it's amazing. A few years back, no one could have believed that South Africa could be the biggest treatment program in the world, with 3.4 million people put on treatment. And also, I can say South Africa also helped us to demonstrate that we can even control the transmission from mother to child. But your question is pertinent. Why? Why is pertinent? Because you just ask us why we still have this infection growing amongst adults. I think we have 3 main reasons. We fail with the young girls, adolescent women. We are seeing every single places, particularly in southern part of Africa, that we have more and more young girls being affected. 75% of the total infection, I said 75% of the total infection in sub-Saharan Africa amongst adolescents are young girls. If we don't stop that, if we are not capable to break this trajectory, we will not be reducing infection. Secondly, I think the key population, people who have been left behind, 35% of the new infection, I'm talking about sex worker, drug user, man having sex with man. You take Eastern Europe, Central Asia, increase the last 5 years by 57%. If we don't reach them, we will not be able also to really end complacency.
There's a number of targets we're aiming for, isn't it? 2030 is a key one. Also the 90-90-90 target by 2020. What will it take to achieve the eradication of AIDS? I'm sure money, investment, donor investment is key.
You know, I want to just say that, again, I'm scared. I'm scared because what helps us to make a difference in this fight is global solidarity. Solidarity from civil society, but I am seeing them squeeze from all sides and not having access to resources to continue to create certainly this alternative service delivery system between service provider and community, creating demand. But also I'm seeing donor cutting their resources. And that is not a great moment. If we are in the period where we should accelerate, where we should fast track. If we are missing, I just said, the opportunity we have to for the next 5 years to break the backbone of the epidemic, we'll have a rebound on this epidemic. And funding will be critical.
Michel Sidibé is the United Nations Executive Director for UNAIDS. Thank you very much indeed for your time. Let's hand you back to studio.
It was okay.
All right, Blain, thank you very much. Our reporter Blain Herman covering the AIDS conference for us there with the Executive Director of UNAIDS, Michel Sidibé.